patients who were told their blood work was normal. Before we get into the foods, in this video I'm walking you through 5 specific foods that the evidence shows can lower chronic fat. I've spent 21 years treating insulin resistance before it turns into full diabetes, and I've seen the same pattern play out in hundreds of patients who were told their blood work was normal. Before we get into the foods that will actually help you break this cycle, you need to understand the chaos that chronically elevated insulin is creating in your body first. Here's how we're going to break it down so the food list at the end actually makes sense instead of just being 5 random items you forget by tomorrow. Let's start with a reality check. How do it in your entire body? And it touches almost every system you've got, not always in a friendly way. You might be dealing with things that feel like a random collection of unrelated problems, but they are often all connected to this one hormone. I'm talking about energy crashes about. You go from fine to foggy and irritable out of nowhere. I'm talking about sugar cravings that hit hardest. No matter what the rest of your body looks like. You might notice you get sleepy immediately after a meal, especially anything with bread, rice, or pasta. You might have been told your cholesterol panel looks a little off without anyone explaining why. And you might have noticed that skin tags have started showing up on your neck or under your arms. Something almost nobody tells you is a visible sign of insulin resistance. But the biggest telltale sign is this. You eat plenty, sometimes more than plenty, and you are still hungry within 2 hours. That's not a discipline problem. That's a hormone problem. If that sounds like your life, you are not just getting older. You are likely stuck in a state where your body has stopped listening to insulin the way it should. So what exactly is insulin, and what is it doing to create all of this? Insulin is a hormone produced by your pancreas. Its job is to act like a key. It unlocks your cells so glucose from the food you eat can move out of your bloodstream and into your muscles, your liver, and your fat tissue, where it gets used or stored. Now, you're probably thinking, sugar is fine, right? And for years, that's exactly what your blood work implied. But here's the part almost nobody explains to patients. Your body can keep your blood sugar looking perfectly normal for years by simply producing more and more insulin to force that glucose into your cells. Your glucose number stays quiet. Your insulin number does not. We always look at the blood sugar test because that's the number the lab flags. But the real story, the resistance building at the cellular level, shows up in your insulin levels first, sometimes a full decade before glucose ever moves. This is why your fasting insulin, not your fasting glucose, is the number that tells you the truth early. When your cells stop responding properly to insulin, your pancreas compensates by producing even more of it. That is chronically elevated insulin, and it is doing damage well before your blood sugar ever confirms it on paper. Over time, that excess insulin signals your fat cells to store more and release less. It drives inflammation. It disrupts your hunger hormones, which is why you feel hungry constantly even after eating a full meal. It is mechanistically tied to fatigue, stubborn abdominal fat, and over the long term, to your risk for type 2 diabetes and cardiovascular disease. Before we get into the foods, we have to talk about how you actually find this out for sure. If you suspect your insulin is high, you might ask your doctor, and they'll usually run a fasting glucose test or maybe an A1C. But here's the problem. Those tests are designed to catch diabetes, not to catch the 10 years of insulin resistance that happens before diabetes. Unless your glucose has already crossed into an abnormal range, a standard panel can come in back completely normal while your insulin is quietly elevated. The test that actually tells the story is a fasting insulin test, a simple blood draw that most doctors never order unless you specifically ask for it. Alongside that, a marker called HOMA-IR uses your fasting glucose and fasting insulin together to calculate how resistant your cells actually are. This is the difference between guessing and actually knowing where you stand. Let me tell you about a patient I'll call Walter, 66 years old, retired, active, walks his dog every morning. This is an illustrative composite built from patterns I've seen across many similar patients, not one individual's real record. Walter's glucose came back completely normal on his annual physical. His doctor cleared him without a second thought. What his doctor never checked was his fasting insulin. When we finally ran it, it came back at 22. A healthy fasting insulin level is generally under 8. Walter had been carrying stubborn belly fat for over a decade, and every doctor he'd seen told him it was just part of getting older. It wasn't age. It was insulin that had been climbing quietly for years while his glucose test kept it. Here's what 21 years of treating this has taught me. Insulin resistance is reversible in a large number of cases. especially when caught before it progresses to diabetes. And it does not require a prescription, a starvation diet, or superhuman willpower. It requires targeting the chemistry directly, and that starts with what you eat. We aren't just picking random healthy foods here. To lower insulin, we're looking for 4 specific nutritional mechanisms that act like a reset button for an overactive insulin response. First, we need foods that slow glucose absorption, because a slower rise in blood sugar means a smaller, gentler insulin response instead of a spike. Second, we need foods rich in specific plant compounds that improve how sensitive your cells are to insulin in the first place. This is the piece most food lists never even mention. Third, we need foods high in fiber, because fiber feeds the bacteria in your gut that produce short-chain fatty acids, and those compounds are directly tied to better insulin sensitivity. Fourth, we need foods that reduce the chronic low-grade inflammation that sits underneath insulin resistance in the first place, because inflamed cells are resistant cells. Now, later in this video, I'm going to show you the one food on this list that has actual head-to-head clinical data against a prescription diabetes medication. But before we get there, you need to understand why the first few foods matter just as much. Because most of berberine itself, most commonly available as a supplement extracted from plants like barberry and Oregon grape. This is a powerhouse because of one specific mechanism. Berberine activates an enzyme called AMPK, which is essentially your cell's energy sensor. When AMPK is activated, your muscle and liver cells pull glucose out of the bloodstream more efficiently without needing as much insulin to do it. In multiple clinical trials, berberine has shown blood sugar and insulin-lowering effects that researchers have directly compared to metformin, one of the most commonly prescribed medications for insulin resistance and type 2 diabetes. That does not mean berberine replaces medication, and you should never stop a prescribed medication without your physician's guidance. But for someone looking for a foundational food-based intervention, this is the one with the most direct mechanistic overlap with pharmaceutical-grade insulin sensitizers. I personally recommend Thorne's berberine phytosome to my patients looking for a well-absorbed, third-party tested option, and I'll leave a link in the description if you want to look into it. This is an affiliate link. Using it supports the channel at no additional cost to you. Number 2 is cinnamon, specifically Ceylon cinnamon rather than the cheaper cassia variety, which contains higher levels of a compound called coumarin that isn't ideal in large amounts over time. Cinnamon contains compounds that mimic insulin's action at the cellular level, essentially helping glucose move into cells even when insulin signaling is sluggish. Several clinical studies have shown measurable reductions in fasting blood sugar with regular cinnamon intake over a period of weeks. It's inexpensive, it has essentially no side effects at food-level doses, and it's one of the easiest additions to make, stirred into coffee, oatmeal, or a smoothie. Number 3 is fatty fish. Think salmon, sardines, and mackerel. The same foods that show up again and again across metabolic research for a reason. The omega-3 fatty acids in these fish reduce the chronic low-grade inflammation that sits underneath insulin resistance. Inflamed fat and muscle tissue physically block insulin receptors from functioning properly, so lowering that inflammation is one of the most direct ways to restore insulin sensitivity rather than just managing the symptoms of resistance. Multiple studies in adults with metabolic syndrome have shown improved insulin sensitivity markers after regular fatty fish intake over 8 to 12 weeks. All 5 of these foods work best as a long-term rebuild, not an overnight fix. But if you need something to act on the next time you sit down to eat, I have a separate video walking through 3 things you can do in the first 10 minutes after a meal to blunt an insulin spike in real time. That one's worth watching right after this. Number 4 is legumes, lentils, chickpeas, and black beans specifically. These are one of the most underrated foods on this list because people associate them with carbohydrates and assume they spike blood sugar the way refined starches do. The opposite is true. Legumes are extremely high in soluble fiber, and that fiber slows digestion dramatically, which means the glucose from a bean-based meal enters your bloodstream gradually instead of all at once. That gradual entry means a smaller, gentler insulin response. On top of that, the fiber in legumes feeds the specific gut bacteria that produce short-chain fatty acids, and a randomized trial showed that participants given a dose of these short-chain fatty acids had a meaningfully smaller insulin spike after a subsequent meal compared to those who weren't. Your gut health is directly tied to how much insulin your pancreas has to release. And finally, number 5, apple cider vinegar, but there's a catch. It has to be used correctly, diluted, and taken before a meal rather than after. A small amount of vinegar taken before a carbohydrate-containing meal has been shown in clinical research to blunt the post-meal blood sugar rise. That means less insulin is required to clear the same glucose load. My most common recommendation is 1 tablespoon, diluted in a full glass of water, taken about 10 minutes before your largest meal of the day. It should always be diluted. Undiluted vinegar can damage tooth enamel and irritate the esophagus over time. Using food to directly target the mechanism rather than just cutting calories is one of the most effective ways to tell your body it's safe to stop storing fat defensively. But if you've been carrying stubborn weight for years and nothing has worked, you deserve to actually know where your insulin stands rather than guessing. If you want to stop guessing, ask your doctor specifically for a fasting insulin test, not where. Just a glucose panel. Say the words, "Never had this test ordered." I want to know how many of you have been flying blind on this exact number. Getting your insulin right on is not about willpower. It's about giving your body the specific inputs it needs to stop defending fat and start releasing it. Your doctor checks blood sugar. Now you know the number that actually matters. If this explains something your last checkup never did, the next video you should watch is the one on the 3 things you can do in the first 10 minutes after a meal to blunt an insulin spike immediately. It's the fastest acting companion to everything you just learned here.